Hey everyone, I'm Ariana Parks, physical therapist, and today I interview Dr. Heidi Jannenga, and she's going to talk about the top drivers of patient retention in physical therapy and the key trends, challenges, and opportunities impacting the PT industry. Dr. Jannenga is a physical therapist, the co-founder and chief clinical officer of WebPT, and advocates for the rehab therapy profession. In our discussion today, you will learn the key takeaways of the State of Therapy Rehab Therapy Report and the PT Patient Experience Report. So that includes the employee retention and satisfaction, and strategies to better attract, retain, and satisfy patients, and the drivers of the patient-perceived PT success. If you feel this information is valuable, please consider subscribing to our channel, clicking on the bell so you don't miss anything, give us a thumbs up, and share this with other clinicians you feel might benefit from this conversation. I hope you enjoyed the show. PT Pro Talk podcast is only possible with the support of the forward-looking and innovative company Systems for PT, the Do Anything, Anytime EMR. Systems for PT develops systems for clinics so you can focus on your patients. Go to systemsforpt.com to schedule a demo today. Hi Heidi, welcome back to PT Pro Talk. How are you today?
I'm so good, Mariana. It's really, really great to be here. Thanks so much for having me on your show again.
Yes, it's my pleasure. So let's start talking a little bit, just briefly for the ones that don't know you. Just tell us a little bit about yourself.
Sure. I am a physical therapist who practiced in outpatient and sports medicine for about almost a little over 15 years before starting a software company called WebPT. And we're actually going to be celebrating next year 15 years after launching WebPT. So it's been an incredible ride clinically, as well as, starting the software company. So we now have over 50% market share utilizing WebPT in the US and in outpatient orthopedics. And we serve both PT, OT, and speech therapists all across the country. So it's pretty cool. And I'm really excited to talk about our State of Rehab Therapy report that we do every year with you.
Yes, that's amazing. Congratulations, 15 years. That's awesome. So I know you do that every year, right? I think it's the 6th report. So just tell us briefly, because I know it's a long report, what are the main points about the State of Rehab Therapy report?
Well, along our path, we've always, part of our mission is to empower therapists to achieve greatness in practice. And part of that is understanding what the industry is doing and what the most important things are that are going on in the industry so that we can participate, we can help, we can make sure that we're aligning what we're doing to, industry trends. And when we went to do some research to try to find out a lot of that information, we couldn't really find it, or it was very, it was just dispersed in a lot of different places where we couldn't go to one or two places to find that information. Of course, the American Physical Therapy Association has a lot of info, but it's all locked behind a firewall. So if you're not a member of the APTA, then it was really difficult to get any of that information anyway. And even then, it didn't really have specific info on a range of different sizes of practices. So anyway, we decided to put out a survey ourselves and collect some of that info and start to try to, figure out what some of those biggest trends were. And so we launched the State of Rehab Therapy back in 2017 to sort of get that pulse on the latest trends in the industry. And what we found was that this information was super valuable, not only to us, but to all those that were also looking for this information. And so we decided to make it an annual report. And for this year's edition, we surveyed close to 7,000 PT, OT, and speech professionals from all different roles within the industry to really better understand what's really happening in rehab therapy today. So survey unearthed a wide range of data. So just topics like diversity, productivity, staffing, and turnover, burnout, You name it. We threw a lot of questions out there, and just so happy that people are responding and put out the beautiful report that you were referencing earlier, close to 100 or a little over 100 pages of data, graphics. So anyway, it's available. Just if you go to WebPT.com, State of Rehab Therapy, you just Google that and it'll pop up, and we're happy to share that information out with everyone.
Awesome. That's awesome. That's a lot of information. And I know, like, in part of the report, you have the big takeaways. Do you want to just mention briefly about them?
Yeah, I mean, there's so many takeaways. I mean, some of the big topics was, patient experience. That was a big part of our report. We surveyed a lot of folks on, what does that patient experience look like today? And I think we're going to talk a little bit about some of the data points there. Employee retention and burnout. That was a big topic, as you can imagine, with the great resignation that was happening in all industries, also affected us in the rehab therapy world, with roughly 9% of turnover rate in this past year, which is way higher than our industry average, which is only 3.7%. So, that's a big issue that we're grappling with right now. And some of the student debt issues, the role of academia and how that's sort of intertwining with, how we think about, our workforce and diversity in workforce, things like that moving forward.
Yeah, that's a huge number, 90%.
9.
Oh, okay. I was like 90%.
Yeah.
Okay. But still, why do you think is that happening? Do you feel like it's the burnout of the profession?
Yeah, I mean, there's a lot of, I think, reasons, with reimbursements continuing to decline, in order for, and inflation happening and practices having, operational costs that aren't going down, the natural progression is to increase patient volume. So we saw the number of patients per day per therapist jump to 20 patients per day in some practice settings this year. Which is higher than it has been. On average, it's been somewhere in the 14, 15 range. And so that's a pretty significant jump in a shorter period of time. Not unheard of, and with the right sort of technology and perhaps processes that are in a practice with ancillary staff assisting, there's no reason that you couldn't do that. But that's a big jump if you don't have those things in place. 70% of the respondents were considering a professional change. So definitely burnout has something to do with, this uptick in dissatisfaction, I guess, and this difficulty with employee burnout, as well as the employee retention. We also saw numbers like 14% citing they're considering moving to a non-clinical role. I can just say anecdotally here at WebPT, we have had by far the highest number of PTs who are applying to non-clinical positions within our organization. Just this year alone surpassed the number of PTs that we've had in the history of the company. So it's definitely an issue of people trying to figure out, did I choose the right profession? Is the profession going in a direction that I thought and think it should? And frankly, I mean, as just like everyone, right? The pandemic had a lot to do with that, as far as changing in how you were able to do your work, sentiment of patients, and just the burden of on the organizations that are running these practices as well.
Yeah. I mean, 20 patients per day, it's a heavy load, and it's understandable why PTs are feeling that way, because then it's quantity over quality, right? And with these reimbursements going down, like, where do you see us going as a profession? Because it doesn't look like it's gonna get any better, and the PTs are getting really frustrated with, at least a lot of PTs that I talk to that working like these companies that they have a big load, heavy load of patients.
Yeah, I think that the future is always bright. I'm an optimist, and I always think the future is going to be bright. But there's so many positive things that are also happening that really shine a spotlight on the value that we provide to the overall healthcare system. So there's so much more data information coming out now with regard to the future of PT looks more, especially after the pandemic, it really accelerated the use of telehealth and virtual visits, right? And so the future could look more hybrid the more people are willing to adopt technology and put that into their new plans of care and how that sort of works with the patient journey and patient experience. And to me, that really helps with some of the work-life balance and flexibility conversations that therapists are now having with their employers because they want more flexibility in their work schedule. And so I think that helps to bridge that gap with the ability to utilize, some telehealth days where perhaps you're doing more just check-in visits via telehealth versus having to, do the patient volume. Now, patient volume is going to be higher on telehealth visits, but it's not the same physical rigor that you would have to do when you're actually seeing patients in clinic. So that's one thing. And then the second is just the increasing awareness overall of physical therapy. And if you think about it from an employer standpoint, musculoskeletal care is now the number one cost in US healthcare. It's the number two reason that people seek out healthcare behind the common cold. Is low back pain or some kind of musculoskeletal pain. So the value that we can provide to the general population is never been greater. And so our services are needed. It's really just now trying to figure out how do we connect that with and be commensurate with payment for our services and the value that we're actually creating and dollars that we're saving downstream.
Yes, that is huge because we have the solution for this big problem in the healthcare system. And when you mentioned technology, that made me think about that the other report that we are going to talk about, the PT patient experience report, that it mentioned a lot about technology and how that's important in the value that we provide to patients, right? So do you want to start talking a little bit about that report and the what is the report about and how that can help our clinicians here to retain more patients?
Yeah, well, the patient experience report was done, as you probably know, we made a big acquisition of Clinicians, which is another EMR in the PT space. And they had started this patient experience report, and we just pulled it into WebPT and really helped to expand the reach and the feedback was just tremendous. And one of the biggest highlights was around how much communication is contributing to the overall patient perceived success. And so obviously we know the relationship and connection with your patient equates to how the outcome is going to be perceived by the patient. So it's obviously an ongoing process. It's not just during the initial evaluation. But with the survey that we did, we found that only 30% of patients were receiving regular communication between appointments. And so, it's kind of the old school way of you go to a visit, you see the patient goes away, you never talk to them again until the next time that they come in. And so that disconnect is not helping with home exercise and adherence. And so they're may do nothing in between visits, and they only think that you are supposed to help them get better, right? And we know that's not true, and that patients must be more compliant with their home exercise program to get the best outcome. And so, the therapists that are sending their patients away with the paper format home exercise program versus a digital one are getting significantly less adherence, as well as decreasing the overall patient perceived outcome. So digitally optimized home exercise programs are definitely the way to go, as well as 83% of patients who received their exercises digitally reported success in their care. So they're so used to doing so much, having digital access in every other aspect of their life. The expectation is that if I'm going to be seeing a therapist or anybody, right, that same sort of technology use should be translatable into healthcare. And that's not always been the case. Healthcare tends to be a little bit of a laggard in terms of the adoption, and rightly so, because we have a little more constraints with HIPAA and everything else. But patients are definitely ready for it. And this was the remarkable thing is, especially after COVID, with so many more older adults adopting more technology with FaceTime and trying to keep in contact with their family members, that there was really no age differential as far as, patients who were under 45 or patients who were over 45. Both of them preferred an online option versus the paper route, which I thought was really remarkable. I don't know that would have been true, 4 or 5 years ago, but that's where we are today. It's been accelerated tremendously.
Yes, that's crazy, because you would think that they would prefer the paper version, especially the older people. Like if I had to guess, that's what I would say. And I think a lot has changed since COVID. People are more familiar. They are more used to having everything virtual. So I think that's a big shift, and we have to keep up with the trends.
Yeah. Yeah. The other big thing that we found in the patient experience report was, again, it seems intuitive, but obviously not that many people are doing it well, is setting up clear expectations for the patient in the initial couple of visits. So what can I expect through my patient journey here at in my visits with you? What is my expectation of success at the end, or my outcome? Am I going to get 100% better? If that's what the patient is thinking, they're going to get 100% better, and you are thinking, well, we're going to get you about 75 to 80% better. That last 20% is going to take some time, and you're going to need to continue to do X, Y, and Z. If that's not clearly communicated in the beginning, then you have a disconnect when it's time to discharge that patient or on that last visit, because they're not going to think they're done, and you're going to say, oh no, we're done with all the goals that we had set for you. So the report showed that 86% of patients who had clear expectations said that they would recommend their treatment. And 74% of them who had those clear expectations said they would actually then repeat their treatment, meaning they would come back to that clinic and that therapist again. So those are the types of repeat patients that you want to keep a practice going, and also obviously have raving fans, whether that's social media or, patient satisfaction scores. Those are the types of patients that, become your testimonials and all of this kind of thing. So anyway, that clear communication was by far the biggest, point that we took away from that whole patient experience. What creates a best patient experience is to clearly communicate. And that means from the front office to the therapist, anybody interacting with a patient, the clearer the communication, the better, which obviously only makes sense, but it's nice to see it in data format from actual patients themselves.
Yes, and I think that the clear expectations is also communication in a sense, because the patient, the therapist has to have the ability to be very clear with the patient right in the first day, to set the expectations right, and how important it is in the assessment to take the time to do that. Because again, if you are with like heavy loads of patients, it becomes more difficult to spend that time to really talk to the patient and answer their questions and make it everything super clear about their goals and expectations, right?
That's right. And, the biggest complaint I hear from therapists is, well, we don't get paid for, checking in with the patient and that sort of thing. And that's no longer true with RTM. So the remote therapeutic monitoring codes, we're now able to do some more of those. Those are, a solution perhaps that patients can be monitored by their therapist, whether it's their home exercise program specific, you know, um, data points that you're collecting along the way to meet the RTM criteria. But by far, patients really want it. And now insurance companies are starting to, specifically Medicare now with the RTM codes, are recognizing that, this interim connectivity with the therapist only makes the outcome better and perhaps even shortens the episode of care because the adherence is so much higher with the patient. And it prolongs that connection to where for you as a therapist, again, like we said, that perhaps is a repeat patient down the line, or there's another family member. I don't know about you, but one of the biggest points of respect where I knew I had really had the trust of a patient was when they're dragging in their husband or they're dragging in their kid to come see you for some other ailment, that they're having. Like that was like kind of the deepest level of respect, that they trust you with a family member, right? Now that you have helped them or you've established that relationship with your patient so much that they want to drag more folks in to see you.
Yeah. And I think that's important, like this feeling that they are being cared for, that you are there supporting them if they need, that is just not in that hour in the clinic that they can have access and ask questions and make sure they're doing right. So it's just overall a better experience. Um, and and do you feel that that's something that is becoming more common between the physical therapists to
It's definitely
implement those
starting up. So
strategies?
last year was the first year that we, as therapists, were able to bill the RTM codes and get reimbursed for it. And so this year, then there were some people that were starting to adopt it last year. I think it's technology had to catch up, and so today, and through 2023, we really see a ramp up of the adoption and understanding, frankly, of what RTM is. What are the factors that are required to meet the criteria to be able to bill and get paid for RTM? In our platform with our Reach program, Reach product, we're able to meet the criteria for our KEAT and REACH protocols, able to meet the criteria for RTM.
Awesome. And do you feel that's relatively easy to implement on the PT's routine, since they are always like busy with the patients, in like practical terms, how that's gonna be like in the day to day?
Yeah, I mean, it takes a different scheduling mode, and what we're seeing is blocks of time. So you just in your scheduling and how you schedule your patients, you're on a schedule. You're blocking time to just do this remote therapy monitoring. So you are checking in and looking at all these data points, communicating with the patient. So essentially, you're visiting with these patients virtually, whether it's through chat or doing some sort of video conference call, something like that, to where you're checking in, and they have to be on specific increments, right? And so they're very clear criteria. We'll be talking about it on some. We have done a whole RTM webinar that people can go take a look at. We walk through everything in detail. So I would highly suggest if you're interested in RTM, it's not something you can just spin up tomorrow. It's definitely got to be a thought out process to where you are working with your therapist, having the right technology platform to do that connection and document appropriately so that you can be billing for those specific codes.
Yeah, so people are gonna have to start blocking those times and do that this like separated from your normal workload so you can have the time to do that. And that includes like messaging, text message. You said like video conference as well, so you can do some kind of like online checking with the patients too. We can talk to them to see if they have any questions about exercise. Is that how it looks like?
Yes, there's a little more to it than that. But yes, any of those methods are part of what you're able to do and check the box on patient communication. And so, but there are, a few more pieces of criteria on what you're actually and how you're documenting what you're doing and what you're checking on, and if you're progressing their programs, things like that. So, again, I would highly recommend watching some of our webinars that we've done on this to get all of the detailed information around RTM specifically, because it is fairly new. And the good news is in the final rule for 2023, they haven't changed the reimbursement that or payment that you get for RTM. It is not under the cuts. And so again, another potential revenue stream to help offset some of the cuts that, cross our fingers, hopefully everybody's advocating right now and talking to their Congress folks whenever they can, because we're down to the wire now and trying to get the cuts beat or at least postponed, kick the can down the road for another year so we don't have to endure that in 2023. But as we talked about earlier, it's just another avenue, in my opinion, to combat some of the things that we found in the State of Rehab Therapy report with regard to this work-life balance, of having some flexibility of, if this is a bigger issue with, the patient contact care, is to offset it with some flexibility time in this remote monitoring, right? Or telehealth visits, totally separate, but potentially seeing patients virtually versus having to see them in clinic every time.
Yeah, and it's good. Also, a good break for the PTs physically, so they can take a break and maybe, I don't know, do it from home if possible. Have some
Yeah, as long
flexible
as you have
hours.
a secure workspace and meet the HIP requirements, things like that. Absolutely, that's exactly what we're talking about.
That's awesome. I think that's going to be very helpful. Good news for our profession. And so any other thing about the top drivers of patient retention that you want to mention? I know you have like a little like top 10 or some steps or anything that you would recommend to our clinicians, other than a lot of important things that you already mentioned about the communication and all of that.
Yeah, I think that, we talked about it a lot, but it's really taking a fresh look for, clinic directors, managers, clinic owners. It's really taking a fresh look. It's no longer, can you just be doing it the way that you've always been doing it? It really is going to take some intentionality in having conversations with your staff, with your team, to understand what, some things that they are asking for. The big piece of our report was managing employee happiness. And so, how do you manifest understanding and knowing what the business expectations are, at the same time as managing employee expectations. And so sometimes there's a big gap between those two, and it may not always be that the employee is the right fit for your practice. I think that's the first one, right? And unfortunately, right now with employee shortage, it can be difficult on the rest of the team if you have a couple folks that quit, and now you're the burden of the volume is now being shared over a much smaller amount of people. But transparency, internal communication, just like we talked about, patient communication, setting up those expectations, having transparent communication, sharing key metrics in the business of what the purpose of why you're doing it, and why, and going back to the why of what we're trying to accomplish in your business is really key, I think, at this point, to going back to some basics. And then I think the incentives are changing. It used to be that clinicians were very driven by money, and that's not always the case. This flexibility component, again, purpose-driven businesses, collectively doing things for the community, some things like that sometimes can actually make a huge difference to their connection to the business and not just be another job. I think, obviously, pay is always an issue because of the looming student debt. So especially for newer grads coming out with more debt than they've ever seen. But some creativity in payback options, 401ks, things like that are really, really critical as we think about this new age of the employee experience as well.
Yeah, and I feel like after COVID, a lot changed too. Like people are putting more value on flexibility and other things that I feel like it wasn't like that before. So there are a lot of other factors that I feel like are impacting the physical therapist experience as well. And another thing that you mentioned, do you want to go ahead and say something? I thought that you were going to say something.
No, I was just going to agree with you. I mean, a lot of things have accelerated or amplified since COVID, for sure. But I will say that, clinics have responded pretty well. Like, in general, like we just came from the private practice section PPS conference in October, and man, it was so great to see so many people there together. And the power of what we do and the value of what we do is there. It's now just becoming a little more innovative and creative and open-minded to changing some of the ways in which we look at metrics, perhaps the specific metrics that we are looking at. It may not only be the number of patients anymore, but really outcomes can sometimes be even more important to be drivers of bonuses and things like that. So that patient connection and I guess sometimes what we call the intangibles, it's not always just the specific data metrics that have to drive the overall satisfaction of what these employees are looking for.
Absolutely. The more we focus in outcomes, I think the better it is, because you feel like the purpose. I feel like most physical therapists start this career because they are driven to help people. So if you are measuring outcomes, if you're seeing that you're really like helping, impacting people's life, I think the motivation is way higher than like anything else. Of course, money is important, but you want to know that you are making a difference. That I think that's the reason we got in this career to get started with.
Yeah, but it's really just starting. And like we started this conversation with, it's intention of the clinics and the providers, mainly managers and clinic owners, to really take a look at, okay, well, how are we doing this? And how are we going to, how do we change or modify going forward? Our report was done basically at the end of last year, beginning of this year. At the beginning of this year, in our report, 30%, almost 30% of those that responded that were clinic managers or owners said they hadn't done anything yet in terms of retention strategies. And so I was really pleased to hear kind of much more attention and priority put to it. And obviously, when people leave, you have to start paying attention to it. But a lot of conversation, a lot of focus on retention and, benefit. How do you change up your benefits more creatively to help combat, some of this fatigue, burnout, and also obviously, you want to keep your great therapists.
Yeah, yes, absolutely. And also the technology part that you mentioned before, like how it's important to provide the clients with this experience, with everything being more practical, easier to get scheduled, to go online and schedule their visits, to pay for their visits online, to have access to telehealth if they want, their home exercise program, their presence on social media, like all of that, how important is becoming more and more. I feel like every time it's, yeah, great.
Well, you have to
Um,
meet the patients where they are, and that's where most patients are now. They're online, right? They're used to Zoom. They're used to more technology in their personal life, and again, it's translatable into how do I make the patient experience the easiest, but also the best experience for the best outcome, right?
yes, absolutely. And even with more people working from home, now they are used to do everything virtual. Some people don't want to have to go
Yeah, they don't
back.
want to leave their homes.
Yeah, yes. Even older patients from, like, I was surprised how it changed it. I have like old clients, they are on their late 60s, early 70s, and they are working from home and they just like the convenience. So I feel like it is changing. Yeah.
Yeah, and you've got quite a few folks that are, I mean, and with the numbers rising again with COVID and whatnot, like they're just, some of them have, comorbidities that don't allow them to, or, at least their perception is, I don't want to take the risk. Right. So,
Yeah.
um,
Yeah.
again, you have to kind of meet them where they are. If we want to increase the numbers of patients that we're able to access and hopefully have demonstrate our value to them.
Yes, absolutely. Anything else, Heidi, that you want to add before we wrap up here?
No, I think we hit on so many things. So thank you for the opportunity again. I'm sure you're going to have it in the show notes of how to retrieve either one of these reports, these valuable reports, the PT patient experience report, or the state of rehab therapy report. That is a lot meatier in terms of having a ton of data. So it'll take you a little bit more time, but it's some good holiday reading. Get you all excited and ready, and maybe, brush up on some ideas to really go into 2023 with a bang.
Yes, absolutely. And the presentation is really good. It's really easy to read. You have pretty graphics. They're colorful. It's super easy to read. So I'm going to make sure to put those links on the show notes. So if people wanted to go take a look, I encourage them to do so. It's not gonna take a whole lot of time. You can just scroll through, see what you like, what is more interesting for you, and just go and check it out.
Yep. They make great stocking stuffers for your clinicians in your practice too.
um, and Heidi, if anyone wants to learn more about you, or if they want to contact you, or is that a way that they can find you?
Absolutely. You can find me on LinkedIn. It's just Heidi Jannenga, Jannenga. Or you can, that's probably the easiest way. But like I said, the report is both on our website. So webpt.com/state of rehab therapy, or webpt.com/patient experience report.
Awesome. Well, I appreciate you taking the time to come share with us all this information, fresh information that is gonna help us hopefully understand better the our physical therapy situation, the what's going on right now, and how to retain patients and improve our our way of treating them and providing them a better experience. So I appreciate it.
Of course, of course. And thank you for all of the great work you're doing to help broadcast some of this important information to more ears out there, because the more we can get folks on board, as far as, understanding the importance of that patient relationship, as well as what's going on and trends in the industry, we need more advocates for our industry and speaking up and fighting for some of the things that make all of our lives just a little bit easier.
Yes, absolutely. Thank you.